All right. Good morning, folks. Happy Friday. And welcome to BARI's 2018 conference. Really excited to have you guys here. All right, so for those who don't know me, I'm Dan O'Brien. I'm the co-director of the Boston Area Research Initiative, and I'm just going to want to take a couple moments to welcome you all here, sort of kick off the day, and then hand it off to a couple other folks who are going to give some opening remarks, and then we're going to jump right into the first panel. So I just wanted to note, so we got a couple really important firsts this year. The first one is, this is the first time we are hosting a conference at an academic institution other than Northeastern and Harvard, and that's a really big deal. So welcome to Boston University. We are ostensibly an inter-university partnership, and this year we are embodying that physically, which I'm very happy to be able to do. So thank you to Boston University and the Initiative on Cities for helping us host it here. It's also the first time we've done a topical theme. So this is an interesting point, right? We've had 3 conferences before, and they've all focused on how do you find the nexus between research, policy, practice, and data and technology. And so I really think that was important that we do that, right? Because it was a new idea, and at this point we're a few years gone, and it seemed clear that it was time to turn to a focus, right? A topic. What could we do with this? We have enough momentum going locally in what I like to call the civic data and tech ecosystem. And I think we can actually start to answer specific questions, and talking to a lot of people, we realized, in Boston right now, the theme du jour is inequality and economic mobility. It's the thing probably most facing the city and representative of the things facing the country's cities. And so we really felt that this was the way to go this year. And so we're really excited to have this conversation all day. And I'm pumped for the agenda we have going. Some of you have probably heard me opine before about the difference between a curated, gilded conference where, a bunch of smart people pick a bunch of other smart people and have them talk at the room, which can be very effective, but also sometimes one way and sort of predetermined in its knowledge. And the other approach, which is a society meeting where we sort of crowdsource what's the best work going on locally. And I think this year we got the best of both worlds. We do it as a society meeting. We did an open call for proposals. And if you look at your agenda, I think we actually got a better agenda than we would have come up with as a conference committee on our own. We got tons of projects that we would have thought of, and tons of other projects we never would have thought of, that we weren't aware of for one reason or another. And so I think we really have the best of both worlds here. It's going to be an exciting day. We're covering everything possible, I think. Classic policy questions like housing, transportation, education, crime, but also some really important current themes like youth employment and resilience, and of course, some good sessions on what are we doing with new data, what are we doing with new methods, and how do they intersect with society. So we've got some great panels, we've got some great keynotes. So with that, I'm going to give way. I just want to thank a few people. Boston University's Initiative on Cities, Graham Wilson and Catherine Lusk and their team for making this possible with us today. To our sponsors, or co-sponsors, Microsoft, the Lincoln Land Institute, Boston Indicators at the Boston Foundation, the Northeastern University School of Public Policy and Urban Affairs, the Harvard University Faculty of Arts and Sciences, and to Brandeis University and the Heller School there. Thank you very much for your support and your contribution to making this happen intellectually as well. And to our keynotes, our moderators, our speakers, especially our staff and volunteers. I'll thank them again at the end of the day, but right now I think if everyone could give a round of applause to Sam Levy and Patricia Cahill and everyone working with them. The punchline there is if you enjoy the conference, don't thank me, don't thank Rob or Chris, the other co-directors of BARI. Thanks Sam and Patricia. They made this happen. And then last of all, thanks to you guys. There would be no point in having this if you weren't here, so thank you for coming. And we're excited to have a great conversation with you all day.
Good morning. I'm Graham Wilson, the director of the Initiative on Cities here at Boston University. I want to thank you all for being here and echo Dan's thanks to the staff who've done such terrific work, both from the IOC and from BARI. We are a relatively young organization. We were created 4 years ago. I was the founding co-director with Mayor Menino when he stepped down after 20 great years as mayor of Boston and came and joined Boston University. And so being a relatively new organization, having BARI here feels like a coming out party to, in a way, a celebration for us of being around and being part of the networks. I think there are a couple of points that I'd like to stress today, and I think that Mayor Menino would be thrilled by this character of this gathering today. 2 points. First, I think that BARI is doing a great job, and as time goes by, an ever better job of linking institutions. When I was chair of the political science department here at BU, when we were recruiting faculty, I used to say, come to Boston. It's so exciting to be in a city that has so many institutions, and yet so rarely do we take full advantage of having so many institutions and building bridges amongst all the great universities and colleges that are in this city. BARI is doing that job, and let's give them a round of applause for doing so. Second point I want to make is also about bridge building. One of the key things that BARI is doing in its work, and particularly in this conference today, is to link colleges, universities, and cities. Mayor Menino believed that colleges and universities had a great deal of useful knowledge that was often locked away in them and not put at the service of the communities in which they were located. Again, BARI is doing a great job through its work in linking colleges and universities on the one hand, and the city of Boston and other cities in this region through its work and through a gathering like this today. So it's really exciting to me to have you all here today. In a way, as I say, it's like a coming out party for us, and it's great to see BARI doing such great work in building bridges between universities and between universities and cities. Thank you.
Thanks very much, Graham. I didn't know what order I was going to be in, so sorry for the start. My name is Nigel Jacob. I'm the co-chair of the Mayor's Office of New Urban Mechanics. And on behalf of myself and the team, there's a bunch of us here in New Urban Mechanics. Can you put your hands up wherever you are? Okay, there you are. So definitely find some of these people at some point. I'll talk about New Urban Mechanics in 1 second. On behalf of the Mayor's Office, New Urban Mechanics, I'd like to welcome you all and thank you all for coming. This relationship that we have with BARI and with Dan and Chris and Rob is really important for us. From the very beginning in New Urban Mechanics, we have been about collaborative research, at different institutions, different researchers tackling different kinds of urban issues, civic engagement, and all kinds of interesting things. And it's not enough for us to be locked away in our bunker downtown thinking thoughts about how to make the city better, but we realize, as Graham was saying, that the real value is to get out and talk to people in different institutions and see what we can do together in terms of understanding this great city of ours. From the very beginning, research has been an important part of New Urban Mechanics. For those of you who don't know, New Urban Mechanics is the city's research and design team. So I always say R&D team, but sometimes the D changes. So sometimes it might be a research and development or research and design, kind of depends. But definitely follow up with one of the people who raised their hand to get a sense as to what that actually means. But in general, our job is to make the city better. And we can't do that by ourselves. We do that by leveraging these awesome relationships that we have with people like yourself. And as such, research for us has always been a collaborative opportunity, finding really interesting people doing really interesting things that we can do together if possible. So much so that we've been spending the last several weeks and several months developing our civic research agenda. Basically an articulation of the kinds of questions that we are asking and thinking about, hopefully as a way to stimulate some interesting collaborative opportunities between you and us. So please check that out. I think we have some hard copies somewhere there, maybe? I don't know, somewhere. Find one of us and ask us about it. But once again, Thanks for showing up, and we look forward to a great day of incredible conversations. And I hope that all of you look at these as not just pie in the sky, blue sky sort of discussions, but rather the opportunity to actually pull off some interesting projects or concrete on the ground things that we can try together. So have a wonderful day. Thank you.
And with that, I'd like to welcome our first keynote up to the stage.
Great. My name is Rob Sampson. I'm a co-director of BARI, and I teach in the sociology department across the river at Harvard University. And along with Dan, Nigel, and others, I want to welcome you as well. It's great to see this terrific crowd, and in a real way that the sense in which these conferences and gatherings have achieved the goal that we set when we hatched this idea, I don't know, about 5 years ago in a conference room over at the Radcliffe Institute for Advanced Study. And the inter-university dialogue has just been terrific. So again, welcome today. So the first session, as Dan noted, inequality is a major theme, not just in Boston, but really around the country, internationally, actually. And what we're going to do is start out with that today. And this particular panel is titled Overview of Inequality and Mobility in Boston, Merging the Empirical and the Practical. And we have two terrific keynote speakers. Information is in your packet, I believe. Tim Reardon is Data Services Director at the Metropolitan Area Planning Council. He uses analysis and technology to support public engagement and informed decision-making. Monica Valdes Lupi is Executive Director, Boston Public Health Commission. She's a key advisor to Mayor Walsh on health issues and building partnerships on all sorts of factors related to inequality, housing, economic development, transportation, environment, and so on. So you can see that we really have a nice mix of speakers here. And so what we're going to do is have each keynote go about 10 minutes or so, right? And then we're going to open it up for questions, and I'll moderate. So be thinking as you're listening, questions you'd like to ask the panel, and we will have time for them, even though this is a relatively compact session. There's a lot to jam in today, but really excited to start off today with Tim and Monica.
Thank you, Rob. And thanks for everybody for coming out this morning. I'm very excited about it. I was telling Monica that I was on the review committee for all the proposals that came in, and it was an incredible set of proposals for talks today. Very difficult choices that the committee and Dan and his staff had to make to get what I think is a very exciting and very thought-provoking set of panels and discussions today. So I don't think we want to keep you too long. We want to get to that. But I actually want to start by encouraging you to think about what happens after today, not just in the panels, but actually where we go with this information and what we do with all of the new data and information and techniques and processes that we're going to learn about today, and what we do with that, and how we take that beyond the data analysis and beyond the places where we are currently working. So I want to sort of talk about what it means to go beyond there. And I think the first is that it's really important, and this will come as no surprise from coming from someone who works at a regional planning agency, that we really do have to look beyond Boston as we're looking if we want to tackle inequality and economic mobility. Boston is, of course, the principal city in the region. It's home of the Red Sox. It has an incredibly sophisticated municipal governance and is naturally the hub of the universe, as we all know. But it's not the only place in the region where economic mobility and inequality are really, really stubborn issues. Right now, Boston contains about 670,000 people, but that's only 20% of the MAPC region and only about 14% of the metropolitan statistical area for Boston. Compare that to New York City, which comprises more than 40% of the metropolitan statistical area. So if we can think about that, it's 4 out of 5 people in the Boston region don't live in Boston. And so we really do need to think about what happens outside the city if we're going to tackle these issues. There's a lot of communities, a lot of challenges, and a lot of opportunities outside of the city proper. And the systems that created and perpetuate inequality and stymie economic mobility extend far beyond those cities' borders. And so in order to address those issues, we really need to look beyond. Just to take one example, we could study gentrification and the overheated housing market until the cows come home or until the backyard chickens come to roost, let's use a better metaphor. But we won't really understand what that means until we also understand what happens to people when they're displaced from the city of Boston and where they go and where they end up and how that will affect their life and the opportunities that their children face. So, we know that Black and Latino home loans are highly segregated within the city of Boston and concentrated just in a handful of communities. And while I think we'll hear today about how maybe racial segregation is ebbing slightly, economic segregation is very strong, but we still see a lot of segregation in the housing market within the city, but it's not nearly as bad within the city as it is in the rest of the region, where more than half of the home loans to Black and Latino home purchasers are concentrated in just 10 municipalities statewide. Half of all Black and Latino home purchases are concentrated in 10 municipalities statewide. So we're seeing tremendous segregation outside the city of Boston that we really need to understand. And what's troubling even more so are some of the characteristics and opportunities that are presented to folks who are moving into those communities. So if we look at where Black and Latino home purchasers are buying homes, and then just look at some of the educational opportunities that their children experience, we'll see that the MCAS standardized test scores tend to be much lower for those communities where we're seeing higher proportions of Black and Latino home purchasers, which then has a corresponding effect of impeding the intergenerational economic mobility that the children of those home purchasers may find. So. So I think that's just one example of how we have to expand the scope of analysis beyond Boston if we're going to truly understand the fates of folks who are displaced or who are seeking opportunities elsewhere. And until we do that, we won't really know if we've solved the problem in Boston or if we've just moved it to another place. So I would encourage you, as you sort of think about the practices and techniques and analysis that we'll hear about today, think about how those lessons can be transferred to other places, how that data can be developed for other communities, and how the policies that it suggests can also be transferred to other contexts within Metro Boston. And the second piece is that while it's necessary to expand our geographic scope, it's also really important to look beyond the data analysis that so many of us love. We all have a charge to change the nature of our work from simply doing the analysis and developing the data to actually focusing on engaging communities in finding the solutions that are really going to change, that are going to make a meaningful difference and meaningful change in their lives. It takes more than analysis, and it requires the difficult step of developing institutional change and changing institutional culture to advance diversity and equity within the workplace and also position every organization to be advocates for equity throughout the region. And that is a sometimes difficult process, as we have seen within MAPC, and I want to sort of walk you through our journey over the past 6 or 7 years as we've done that. In 2011, we released the State of Equity in Metro Boston, which was our first regional indicators report. That was intended to help illuminate the various dimensions of inequity in the region, and the results were striking, and served as a basis for a policy agenda that we developed shortly thereafter, which articulated a theory of change related to equity and cataloged a series of policy priorities that could help to mitigate the patterns we observed. But we didn't just focus on the policy piece. This is some of the statistics from that. We didn't just focus on the policy piece. We also focused on how our organization needed to change in order to better effectuate the change that we wanted to see in the region. And we looked at hiring practices and cultural competency, implicit bias and bystander awareness trainings, and how we could diversify the composition of our own governing council so that we would be more representative of the region. We examined the types of projects that we conducted and changed what we do how we do it and who we engage when we do it by bringing a racial equity lens to efforts such as health impact assessments, investing in non-traditional and highly inclusive public engagement activities designed to solicit input from vulnerable populations who are often underrepresented at conventional public meetings. And through that, we started to develop a broader awareness of those issues among staff and our governing bodies, and support for a series of principles that really define our approach to dealing with equity in the region. And with that, sort of all of that pre-work, we were then able to, when we developed a new set of, an update to the state of equity work that was released last year, we were well positioned then to develop an even more robust policy agenda, and which was released in March of this year, that included a number of really new policy positions or highly advanced policy positions for MAPC, looking at things like renter protection, right of first refusal, minimum wage, low-wage MBTA fares, automatic voter registration, having Massachusetts as a sanctuary state. These are not revolutionary ideas, I will admit, but they are remarkable policy positions for a public sector organization whose governing body is a set of municipal representatives and tends to be fairly conservative. And it wouldn't be possible to develop that without all of the pre-work that went into to sort of setting the stage for positioning our council in that way. So, and with that in hand, we're going to continue to pursue equity-minded policies both on Beacon Hill and in all of our municipalities, and add our voices to those advocating for more equitable and just Commonwealth. So I would say that your goal should not be simply to conduct kick-ass analysis, although that's what we all want to do. We have to, your charge, I would say, leaving the conference today, is to take the lessons of the data and turn them into evidence-based, constructive ideas for actually confronting inequality, not just in Boston, but throughout the region and across Massachusetts. So I look forward to the discussions today, hearing all the great work that everybody's done, and more importantly, working with all of you to help achieve the change we need to be a more equitable and economically mobile region that truly provides opportunity for all. Thank you very much.
Thank you, and good morning, everyone. Thanks, just to echo what Tim was saying, thank you for giving us the opportunity to join you all today. When we were talking about how long we've been working in this space of equity and social determinants of health, it is really remarkable to see how much the data has improved over time to validate what we all knew in this room, right? That those social determinants of health related to housing, income, poverty, education really do have an impact on health, and there's so many intersections. So it's really exciting to be with all of you today and to kick off the discussions for what I know will be an exciting lineup of different panels that will dig a little bit deeper on different social determinants. What I wanted to say as a caveat is that what I won't be able to share in this short period of time are all the amazing things that we do at the Public Health Commission, which is the local health department for the City of Boston. And we have colleagues here, if you could raise your hand from the Public Health Commission. So those are the staff who can answer all the hard questions that come my way regarding the analytics. But it's also great to see so many partners from other city agencies. So I'll walk through some of the data that we've analyzed as it relates to the intersection of health and employment and income, and then hopefully we'll get into some of the programmatic highlights in the discussion section. So we all know, you already talked about the Red Sox, so I'll put a plug in for the Bruins making it to the next round, the Stanley Cup, but Boston is an awesome city, right? We have these fabulous academic institutions. All of you have converged today to talk about equity and mobility and looking forward. And so there are so many reasons why. This is just a short list of why we are an amazing city. We have a rivalry with our colleagues at the City Health Department in New York City in terms of having the best tasting tap water. Glad to report back to all of you. Drink the tap water. It's been ranked #1. We're surrounded by a network of internationally recognized academic medical centers, community health centers that rival, no other city. Lots of people come from all over the globe to seek out care in the city. And there are different conditions that make healthy living more possible in Boston than in other communities. I know we talked about Mayor Menino and his vision in terms of taking city departments and making the work that we do more integrated across different academic institutions and partners. But, you know, currently we have a mayor in Mayor Walsh who actually gets the importance of collaboration in the way that Mayor Menino did. And so we were recently recognized by the De Beaumont Foundation and Pew Charitable Trust as being a gold medalist city. So this is a ranking, CityHealth, that looked at over, I think, 4 dozen cities, big urban communities across the nation, and ranked them by how many policies that they had across 9 different domains. And I know, unless you've got really great vision, that's hard to see. But what I'm proud to say is that health is central to many of these policies. So things like having policies in paid sick leave, affordable housing, inclusionary zoning, tobacco 21, healthy food procurement, clean indoor air. Health is central to many of those policies, but we wouldn't be able to have gotten a gold medal according to this ranking if we didn't have a mayor that prioritized cross-departmental partnerships and collaboration and policy development. And so we're really proud that we were one of 5 cities to receive an overall gold medal and one of 3 cities and the only gold city to have a policy in all of these 9 domains. But despite all of these wonderful things about the city and the recognitions and the rankings that we have, we all in the room know that we're here today to talk about those wicked challenges. What continues to put us on lists and rankings that we're actually not proud of. So we've already heard about some of the regional disparities, but we remain, a couple of years ago, according to the Brookings Institute, on a short list in terms of, and I actually think this number has improved, so I think we are actually in the top 5, but in terms of income inequality, 7th compared to other large cities. Really increasing rent in the city that leads to displacement and what you talked about, spillover effects into our neighboring communities. And the issue of race and racism and how it impacts not only health, but other dimensions of where we live in the city and the challenges that we face has been in the spotlight, as we saw recently in the Globe Spotlight series. When we look at unemployment, despite having a 5-year record drop in unemployment in the city at 7%, we know that this is great, but there's still a lot more work ahead of us, and this improvement is not borne equally across our different populations in the city. And what this slide shows on the purple slide is the unemployment rate. In the orange graph or map, population living below poverty level. And what we see for the period of 2011 to 2015 is this crescent shape. And this could be all the health indicators that we track for the most part, right? This map, this crescent shape, if we look at chronic conditions like diabetes, asthma, hypertension, these neighborhoods, which include Dorchester, Mattapan, and Roxbury, have and bear out a disproportionate share of what we see. We see that in terms of having the highest unemployment rate, Dorchester has the highest unemployment rate when compared to Boston overall. Mattapan and Roxbury are actually comparable when we look at the rates. Alston, Brighton, Dorchester, Roxbury had a higher percentage of residents who were living below the poverty level. When we look at this by race and ethnicity in this slide, you'll see that in 2015, which is the most recent data that we had at the time that we did the report, the unemployment rate was higher for Blacks and Latinos at 11 and 9% respectively as compared to white residents in the city of Boston. In this chart, we see that nearly 1 in 4 of our residents in the city live below the poverty level, and women and residents under the age of 18 had higher percentages of living below the poverty level when compared to other groups. When we look at median earnings, we see that for data from 2014, that earnings for female residents compared with male residents was lower across all sectors. very disappointing to see that in the government sector, at all levels, that women working in government made significantly less than their male counterparts. So all of this data that we're pulling from and highlighting this afternoon, and some of the sessions our colleagues are doing, are from our Health of Boston report. In what we're excited to feature in this recent publication is a series of information, our data, that look at health indicators across different social determinants of health. On this slide, we see employment status, but we also have it cut by housing and income and a whole host of other social determinants. On this particular table, we look at employment status, and it's not a surprise. I think we all knew this, but the evidence supports what we knew, that if you were out of work, you were more likely, compared to those who were employed, to experience higher rates of diabetes, hypertension, persistent anxiety, and persistent sadness. And this is data that come from our BRFSS survey. Similarly, a higher percentage of adult residents who are out of work, not just unemployed, suffered from these health conditions more than those that were employed. The slide, a different way of looking at the information, something that I think was a new development and progress for us at the Commission, was how to make the data in the report more accessible. It's a lovely chart book. Many of our colleagues in the room probably appreciated all the data tables and charts, but how do we make it more accessible to others outside of academia and our hospital partners to use the data? So you'll see in the report the use of infographics and also community and community perspectives on different health conditions, and perspectives from different thought leaders. And I also want to put a plug in for the colleagues at the Department of Innovation and Technology at City Hall, who are working with us now to make our data available on the city platform so that people can go in and do their own visualization and stratify the data in different ways. When we look at income and chronic conditions, these mirror what we see in terms of the previous slide around employment. So we know that having an income, even when you have employment, we still see significant challenges when you're not able to be economically self-sufficient and have jobs with great benefits and that allow you to take advantage of different opportunities to be healthy in the communities. So just to summarize some key takeaways, just to set us off for the discussion, it is really exciting to see how far the work has evolved across all of our different areas to leverage data and technology to really drive action for policymakers and for health departments to design programs and to appropriately invest our resources to address these social determinants of health. You talked about the importance of engaging community. That's central in this visual. We have advancing health equity as one of our key strategic priorities at the health department. And all of this work really wouldn't be possible without ensuring that communities are driving us and leading the work that we do at the health department for creating policies and systems changes to create healthier conditions in our neighborhoods and to drive policy changes. And we at the health department know that we can't do it alone, and we need all of you in the room to help us remain accountable and to build on so much work that has been done across our sectors and departments to design health in all policies and programs that are really making a difference and addressing the persistent health inequities that we're seeing in our communities. So thank you again for the opportunity to join all of you, and really looking forward to this next step in the conversation.
Okay, let me thank Monica and Tim for keeping right on time, which means I think we have about 10 minutes for questions and discussion among the keynote. So let's open it up to the audience. Anyone want to start off? While you're thinking, I will start one. It was actually motivated by your comment, Tim, about the nature of the region. So I guess one question would be, from your perspective, both of you, how would you characterize the relationship between Boston and the municipalities or other towns, cities, suburbs, whatever, in the region around these issues? Would you characterize it as one of cooperation, conflict, in need of improvement? Given that much of policy and resources, of course, constitute a zero-sum game. And I would actually also put it in the context of declining federal resources in general, particularly in the current administration. So just wondering how the relationship between Boston and the region is working.
Sure. Well, I would say, I guess to put it in the parlance of like a relationship description, it would fall under the "it's complicated." You know, and I think you see that in, you can see that in, the desire to reopen the shelter on Long Island and the sort of challenges that exist between Boston and Quincy as they're doing that. But I would also say that I think I think we are certainly on the right track as far as developing better sort of regional collaboration that is actually centered around and in many cases driven by the city of Boston and the work that Mayor Walsh is doing. And I'll give you one example, which is the Metro Mayors Coalition Regional Housing Initiative, which kicked off in December and which we are really in the thick of now. So the Metro Mayors Coalition is a group of 15 cities and towns centered around Boston that's actually a convening of the mayors and city and town managers of those municipalities. And led by Mayor Walsh and Mayor Curtatone of Somerville, this regional housing initiative is designed to identify regional targets for housing production, a set of principles that will guide municipal policies related to housing production, local commitments for how much housing each municipality will make, and then a set of best practices that basically can be a template for those communities to work from. So that, I think, is a really good example of a case in which there's a recognition that in order to solve the housing problem, no one municipality can do it alone, that we really need to work together. And by starting with this kind of core group of 15 municipalities and developing agreement on principles and targets, we can actually start to be more efficacious in the kinds of policies we're doing. So I think that's a fantastic example of where we need to go with, and the Mayor's Coalition has done this on a number of things, on climate, on autonomous vehicles. So I think there is a growing set of, sort of really coordinated regional actions in that area.
Monica, do you want?
I think similar to what's happening with the mayor's Metro Mayor Regional Council at the Public Health Department at the state level, Commissioner Burrell has convened a group of I think there's like a dozen large cities in the Commonwealth to try to look at ways that we can learn from each other. We're often, as the largest public health department in the Commonwealth, pulled in to share examples of what we're doing in Boston, recognizing that we're actually fortunate to be fairly well resourced. And so, we actually have an upcoming meeting, I think, in Worcester to talk about our health equity initiatives, but on topics that really aren't just isolated in Boston and where other communities are actually grappling with resource challenges on issues like opioids, for example. We're working across our different health departments to learn from each other. Again, on the issue of gun violence and violence prevention, it's another topic that we've been talking about among the different large city health departments. So there are those opportunities at the statewide level for the larger health departments to work together. And then, just a more recent example, the Commissioner of Health in Cambridge and I are looking at opioids in particular, and it seems like an interest on across the river in looking at opportunities around whether safe consumption sites, for example, might be one of the strategies that they might explore. And so I think there are examples like that on the public health side.
Yeah, thanks. Yeah, those are really good examples. And I raise it too because this is the Boston Area Research Initiative. And I guess it's a good way to start the day, right, in the sense of a lot of these issues cross borders in a way that we sometimes artificially draw the line. So, other questions? Yeah, the blue shirt?
Hello, good morning. I noticed that you both work with very individual, very personal data, especially in regards to health, in regards to social status. So I'm wondering how you collect information effectively with limited resources, and also how you convince people themselves to give that information. And how do you convince them that matters, especially when you can talk about something like equity very broadly, but you still have the issue of the person reporting is going to be as sick tomorrow if they report than they are today. So how do you convince them that it's worthwhile for them to keep giving information?
So I think if I understood your question right, is how do we collect individual information and make the case for why it's important to share that data with us? Is that right, I think?
Yes.
So for us, a lot of the data, well, we use many different data sources to develop the health of Boston. One of the largest data sets is around the behavioral risk factor surveillance system. I actually was one of the people that helped me get through grad school, asking those questions, and so I have a deep appreciation for the length and the questions. Whenever I get the call, I know that it's important. But I think one of the ways that we show the importance of sharing often personal information is to share back that information. And so that's the piece where community engagement is really critical, because I don't think either of us want our data and the reports to sit on a shelf. We want to use the data to drive action at the community level. And I'll just share one example. So yesterday I pulled together a small group of our young people who attend different programs at our Boston Area Health Education Center. And we have been kicking around ideas at the health department about how to get a better handle on different interventions around gun violence, and trying to understand why guns are so pervasive among young adults in urban communities. And so I shared with our students an example of questions, different examples of questions that were included by my counterpart, my colleague in Seattle, King County, in their youth risk behavioral survey. Very specific questions about, do you have a firearm in the home? Does the adult keep it in a safe space? Would the adult or the person who owns the firearm know if you had taken the firearm out of the home and taken it off-site? And so I asked the kids, would you answer these questions in the survey if we asked you these? Because we were getting really excited about looking at replicating those questions and working with BPS at exploring this opportunity. And the kids told me, no, we wouldn't answer those questions, because some of the kids would, even if they did have a gun in the home and they knew their parent, one young lady did share that her dad had a gun in the home, her uncle had guns in the home, it made her uncomfortable, that they would be afraid that that they would be put into foster care, that the data would be shared with their school principals and they would be expelled, or it would be shared with the Boston police, and so I think we have to be careful of potential unintended consequences, but I think it's important to share back the data and help support and facilitate the use of that data to help communities mobilize and to drive policy changes.
Dan?
I'm getting the signal from the corner. We have to wrap up in a moment. So I'm going to take host prerogative and ask a last question. So 30 seconds for each of you. What do you want can people hear me? No. What do you want us to accomplish today? What do you want us to talk about? What sorts of ideas, what sort of momentum do you want to see come out?
So it's a small question. So yeah, 30 seconds each.
I would like to see folks find opportunities to not just to learn from what's going on, but also to figure out how to transfer those lessons to other communities and contexts. And that in everywhere we're talking about how are things happening in Boston and what's happening here is, can we transfer this learning to Chelsea or to Revere or to Randolph in order to help address the same issues in other places where they don't have the same level of institutional support and municipal sophistication. That's our job, but I want everybody else to be thinking about sort of how we may be able to do that sort of work.
I think just to dovetail, it would be wonderful if we could figure out how to mobilize communities to use the data. We use the data but how do we use the data in effective ways beyond your last slide, in terms of beyond the data, what is the narrative that helps supports regional efforts to make the case and advocate for the changes that really need to happen to support improvements in population health across our region. So that would be the charge, is how do you make that data more real and accessible to drive action?
Okay, well, please join me in thanking Tim and Monica for a terrific opening session. And we're off to the rest of the panels. 10 minutes.
You're welcome.